Good afternoon, Oklahoma City. This is Dr. Barenberg, Oklahoma's pelvic health expert, here to talk to you guys today a little bit about female pelvic pain and levator ani spasm or pelvic floor spasm. So I just want to run through the anatomy with you real quick, kind of talk to you about the muscles themselves and a couple of options for therapy. So here we have the pelvic floor, the pelvic bones. You can see there's bony structures, the spine, and then if we come to the view that most of us are accompanied with, this is the vagina and the labia. We have the muscles of the external pelvic floor, the clitoris, the urethra where we urinate from, and the key take home here is that there's a bunch of muscle. If we get rid of that first layer, what we notice is there's a deeper layer of muscle that tends to go from the pubic bone down around the urethra where we urinate, down around the vagina where intercourse happens, and down around the anus and rectum where defecation happens. So if we flip this over and we look from the top, we see the other pelvic organs. So we can see that the bladder is a big ball of muscle that lives right on top of the vaginal canal. The uterus sits at the top of the vaginal canal. We've got the tubes and the ovaries. And then if you look behind there, then we have the rectum and the muscle of the rectum that's left. So the take home now is we switch this around. Again, we've got all of this muscle of the pelvic floor that runs from the pubic bone down around these organs and back up to the other side of the pubic bone. The same way you can get a spasm in your back or your neck, some people carry tension or can get an injury that causes spasm to these muscles. When that happens, you can have issues with urination, like difficulty emptying, starting and stopping of your stream, urgency incontinence, painful urination. You can get pain with intercourse because these muscles where they have tender spots are being, irritated. And then you could have problems with constipation. As you can see, it kind of strangulates the rectum where it turns to exit. So stool gets trapped. So a lot of people will then ask, how do you fix that? Well, there's a couple of ways to start. One of the key footholds in therapy for pelvic floor spasm is hooking up with the pelvic floor physical therapist. Now here in Oklahoma City, we're pretty lucky. There's people all over town from the north side down to Moore Norman and down at the university that can help us take care of pelvic floor spasm. And what they do is they work actually transabdominally, and they'll even work transvaginally to locate those muscles, and they kind of help you learn to relax those muscles so they can function more appropriately. Other things we do are things like muscle relaxers, although those have some downsides in that they can make you sleepy. We even use CBD or cannabidiol, which is a fantastic naturopathic way in which to get anti-inflammatory abilities and pain relief. And then if we're really having problems, we'll even use Botox, where we put you briefly under anesthesia and inject Botox into these muscle bellies directly in order to hope to force them to relax and then to get you back in with pelvic floor therapy so they can be a bit more aggressive. So this is a quick primer on levator spasm. If this rings true for any of you out there, feel free to give us a call at 405-715-4496. We'd love to see you here in the clinic. Again, my name is Ben Barenberg, and I'm Oklahoma's pelvic health expert. Thanks.